So let's talk about methadone and Suboxone. Methadone's been around longer than Suboxone, and it's got a very interesting history with the Germans and all that stuff. But it really came into prominence as a maintenance medication in the 70s in the US. A little bit longer if you go to European countries and even the Middle East. It's a maintenance medication, and it's a straight, full opiate agonist, okay, versus Suboxone, which is a agonist-antagonist. And I wish we had pictures we can do this stuff. And these lend different, so the property of methadone is that it's a full-on agonist, just like, let's use heroin as our comparison, just like heroin. It was sort of the wonder drug, especially in the 70s in New York, starting out as a maintenance medication for getting somebody off of heroin. You do a cross tolerance and you put them on another drug. Why? It's long acting, okay? And it could maintain you, for the most part, at a particular dose. Compare that to heroin. It's not long acting, so you constantly need to redose. That's number one. Number two, you constantly need an escalation of dose. Now you got a medication that's long acting. There is euphoria associated with methadone, which is not the case with Suboxone, but it's long acting, and you can, for the most part, get to a particular dose and maintain it at that dose. Okay? And if given properly and appropriately, it's a wonderful medication, and it has been shown to, the average addict has a increased rate of death 6 to 20 times higher than a normal individual. It's been shown that being on methadone decreases that significantly. It decreases the spread of infectious disease. It makes you functional. It decreases crime. It goes on and on and on. But it's a great maintenance medication, I will say that. There's a lot of problems associated with it because it's very difficult in the United States to get socially, because you got to go to the methadone clinic every day. You got to get up early in the morning every day. The dosing is not necessarily perfect the way they do it nowadays. I mean, from the 80s till now, I think the number of methadone clinics went from 600 to something like 1,500 or 2,000. I don't remember the numbers. There's a huge market for this. But it's a great maintenance medication if given the right way. But being a straight agonist like heroin, it also comes with some problems, including euphoria, and also because people are underdosed at times and they don't get the psychosocial treatment that they should be getting. They had started to kind of mix it up with, they get their methadone in the morning, then they go out, they buy the bag of Mexican heroin. They also start to add benzos to it, which really adds a very nice high to the methadone. In fact, some say it's much better than just doing heroin alone. They'd rather do methadone and benzos. Also, it has some side effects. You can overdose on methadone. It's a straight agonist, just like heroin. You can have cardiac conduction problems. It's a pretty hardcore heavy drug, okay? But the data has shown on an international level, it's a great maintenance medication. I'm just going to leave it at that without getting into too much details. Then you get Suboxone. It's also a maintenance medication. Let me give an analogy. The way I think of Suboxone and methadone is this. I have a certain type of cancer. There's this heavy-duty chemotherapy drugs that I can take. It does get me off the cancer, oftentimes, many of the times, but the drug also has a lot of negative consequences and side effects. All of a sudden, I have a new and improved cancer drug for the same cancer, and there's not too many instances that I really need to use that heavier drug anymore, except for certain cases. So when before it was 10 out of 10 people should have been on methadone or that heavy cancer drug, now it's 1 out of 10 people that should be on it, because most people do better on the new and improved drug. It has less side effects, it has less social consequences, and it's just a cleaner way to go. That's how I think of Suboxone and Methadone. I am a complete advocate of Methadone in the right circumstances, in the right situation. My suspicion is going to be, my opinion, my suspicion from what I see, even though nobody's talking about it anymore because there's so much money with Methadone, is 9 out of 10 people that are going and starting Methadone right now should probably start on Suboxone. But it's such a huge industry, it'll be years before we move away from that. And there's some people that still need the Methadone, but not as many, nearly as many as before. And then there's the old timers that have been stabilized on it or functioning well on it, because Suboxone has much less abuse potential. It has much less side effect potential. It has much less overdose potential. And it's so much easier to get, manage, deal with, and so forth.